Hello, this is Dr. Gossett here today with Mrs. Bardwaj, and she's from Bloomington, Illinois, and she's an RN, and her husband is a medical doctor, and she has had some chronic problems with lower back pain and peripheral neuropathy and radiculopathy into her lower extremities. Tell me a little bit about the symptoms that you came in with.
When I came to see you, Dr. Gossett, I was in severe pain, low back, both my hips. I had pain in both my hips, especially on the right side. My right leg was heavy, numb. I had a lot of tingling and numbness. I was on a lot of medications, which I felt was not helping at all. So I would not take the daytime dose because that was making me very drowsy and sleepy. But when I came to see you, I could not walk even a block. I was in so much of pain.
Okay, so it was shutting your life down.
It was, and it slowly but surely I could see that I was not able to function the way I was 2-3 years ago or before the surgery, which I had in 2013. But it came to a point that I was only doing 1 or 2 grocery stores, not going to the mall, not going shopping, not doing anything, and even to walk in my house, going from one room to the other was a big task for me.
Now, you had been to other doctors before me.
Yes, I ever since I had my surgery, actually before surgery for almost a year, I was with I want to say my primary doctor, who sent me to orthopedics and physical therapy. They had injected me with the steroids and in my back, and I would have relief only for maybe a week to 3 to 5 days, and not more than that. But slowly I was getting to a point where my legs were giving way and I was falling down. I could not do staircase. I could not go up and down the stairs without falling down. I could not even put my underpants or my pants on if I was not holding on to something.
Okay, so you'd had some pretty severe lower back pain for how many years?
I had low back pain
before you came here?
Yes, for a long time. I want to say more than 20-25 years.
Oh my.
But I dealt with it, and I was just taking over-the-counter medicine. And
so you've been to your primary care and been to the orthopedist and had injections, medication, injections?
Yes, this was all this started after I all of a sudden fell. And not only falling, my leg would go into severe spasm, and I could not come out of it. They had to literally give me a lot of muscle relaxants. And I remember one time they had to give me a sleeping pill so that I could sleep during the day because of the spasm and relax. So that's when then they sent me to the neurosurgeon.
And then he did neurosurgery on your lower back?
Yes.
Okay. And you continued to have problems after that?
I did, because he said I had a lot of issues at multiple levels, and he was skeptical about going from the back approach. And me too, I did not want any surgery because I knew it would be very long and my spine would be exposed, and I didn't want any complications. But then he suggested going in from the front and trying to do as much as he could from the front, which he did. He put 3 screws in me. But after I woke up after surgery, what had started actually on my left side and on my left leg, I was having all the pain and numbness on my left side. Surprisingly, when I woke up after surgery, immediately everything transferred to the right side. So that's when they were also confused, thinking that it was some other problem rather than just coming from my back.
Okay. So you'd had medication, physical therapy, injections, and surgery, and still having a lot of problems.
Yes.
And I remember seeing the MRI for you had multiple levels of degeneration. And then you had nerve root irritation causing the sciatica and the peripheral neuropathy.
Right.
So you had a lot going on.
Yes.
So you came in and I examined you and I thought that I could help you. So I recommended a treatment program. And we instituted that. And as we started going through treatment, we always explain, in a very chronic situation like this, it takes a lot of time. What did you experience?
Actually, when I started with you, I want to say within the second week of treatment over here, I was feeling much better, and I could function for a longer time, and on the same medications and whatever I was doing, but I was just doing something more and beyond once I started seeing you.
So your pain
And
level started to go down and your activity level started to
yes,
go up? Okay. Just
yes,
in a short period of time?
yes. With
After-
almost immediately, I want to say within the second week, second or third week of treatment. Yes.
That's pretty impressive.
Yes.
Well, as you progressed, what did you experience with the heaviness and the fullness of this right side, your lower extremity?
As I progressed, it was every time I would walk in, I was very heavy and in a lot of pain. But just being with you for that 1 hour and going from all the tables, I remember,
different
different therapies. When I would leave from here, I was completely, I felt as though I was at zero level of pain, and it was going on for more than, I want to say, with the medications, I would be like maybe for 2 or 3 hours, but once I came here, I lasted the evening and through the night.
Okay.
So
it
yes,
decreased your pain level and
yes,
it lasted longer.
longer,
Okay.
much longer.
Very
yes.
good. So how was your life before you came here for treatment, as far as how you were feeling and what you were able to do activity-wise, compared to after you've had treatment here?
Before the treatment started and before I came to see you, I was doing bare minimal, like just doing little groceries, just going out for necessities. And, you know, within my Bloomington circle, it must have decreased. I was like at 25% of what I would do.
Wow.
Yes.
So you were limiting getting out,
yes,
being on your feet, and
yes,
being active shopping, and which is something you enjoy doing.
right.
I understand.
And
you and your family enjoy shopping.
right.
Okay, so you had to really back off.
I had
on
to
that.
back off on that,
And
and
now-
especially with the kids, because I do have 4 kids, and you know I was
And
very active,
grandchildren?
and grandchildren, and I was very active doing a lot of stuff with them. But then slowly I was just limiting myself to doing just the emergency and necessary things, and not a full. My social life was almost zero, except for very little, for maybe once or twice in a week. So.
We find that a lot of patients that come in when they start, their life is sort of slipping between their fingers. Their
Yeah.
social life is backing down because they don't feel well enough to get out.
Right, and I had to even, my neurologist finally then gave me a handicap sticker because I could not even do the grocery stores if I had parking far away. I was falling, I was not able to do that walk. Take one round in the grocery store was very difficult. So
Okay, so now you're able to.
I'm able to do it better. Yes.
Good. Now, what would you say to someone else who's maybe watching this video and saying, "Wow, that sounds like me. You know, I've had problems for a long time, and I've been to several doctors and had different types of care, and I'm still having problems. Can he really help me?" What would you?
Oh yes, 100%. In fact, 200%. Even if somebody says no, don't go to chiropractic doctors, or you just have to stick with your orthopedic doctor or your medications, I will tell them that no, that is not the regime. You have to come and try this out because it will help you. For sure, yes.
Well, thank you for trusting us, and it's been a
Thank you
pleasure
for
training
helping me, because I had gone through a period where I thought, I would never recover, and I would have had to live with this for the rest of my life. But I really appreciate, and I would continue to do so.
Well, thank you.
Thank you.
So if you are suffering and perhaps have been suffering for a long time and having moderate to severe problems and maybe even thought about just giving up, feel free to give us a call and talk to my staff and see if it looks like we might be able to help you.
Yes. Thank you very much, Dr. Gossett.
You're welcome.
Thank you.